Welcome to stand by your side if you'd like as well.
I'm good here. I can hear from you.
Okay.
Thank you, though.
Okay. Commissioner Moss?
Yeah, just
Or
curious.
So I asked at break here because I wasn't sure. These are agencies that have an interest in our funding and are directly impacted if we have to close our doors and cannot provide local public health services. So we have, anytime we have specific interests in what information we're posting, we'll tag.
So then what did you want them to do with the information?
To be aware, because they're the ones that have to run the local public health department functions if we are not able to function.
Thank you.
Mhm.
Any other questions? I have a question. Why would you think that we would be closing the health department?
I was given a budget request for 2.5 million for general fund funding. That does not meet our minimum maintenance of hours. You cannot count that for minimum funding requirements. So then we would not get any of our state block grants or any state funding because we're not meeting the minimum funding requirements, which means we only can operate on the general fund that's remaining when I take 1.7 away from 2.5. And those were concerns that were raised about what our minimum funding for services and our service level requirements that we have to meet. And all I got back was thanks for that information, proceed with $2.5 million budget. At that point, we're looking at health department closing 4 weeks after October, and the public deserves to know it's a significant threat to public health.
But there are 11 county commissioners. There are, Adeline, and I would never, ever vote to reduce the budget to that degree where it would put the public health at threat. I never would.
I think that's a conversation for Administrator Gibbs. The direction I got from Administrator Gibbs was 2.5 million. And when I raised concerns, it was 2.5 million.
This is why I asked you for FTEs, both budgeted and hired. I asked you about your programs. I asked you about your visit volumes. So I knew your business, so I can defend you and defend the public health department. That was my objective. I don't think I received the total of that information, especially the visit volume. I still don't know which programs are really successful. And I'd love to know that so that we can throw more, it's like resources behind them. But it's come in with drips and drabs. And my intention purely was to understand your business so I could be helpful as a 30-year nurse. And I've worked in leadership roles, so I understand kind of what's necessary to make that determination.
I've shared the information with you that I had available and readily, easily accessible. When I have 48 hours to try and determine some way to function with an unfunctionable number, that's where our efforts and our attention goes to. So as I said, when I emailed you that I would get you the numbers as soon as I could get to them, but I was under the direction from Administrator Gibbs.
But per that 12-page document, my private email to John Shea, that looks like it's been my private email chain from December. I've been asking for that same information, honestly, since November.
And I believe in that email chain, you'll see I've been inviting you to the health department to learn about our programs since December. And I have not had any taking up onto that,
but not any others. So, okay. Are there other questions? Commissioner Miedema?
As we continue to work through the budget process, Adeline, I would really like to request information related to dental services specifically.
Wait, what? Can you say it one more time?
I would love to request, as we continue working through the budget process, I would love more information related to dental services, such as Miles of Smiles. If you could perhaps even just maybe make a 1-page that shows volume of people that have received services from like 2019 through the present, so that we can see the workload that is currently happening. I know that oral health leads to overall health. And so I think that would be really good for us to be able to see the data on specifically dental services.
Commissioner Ebel? Commissioner Zelstra?
Yeah, I guess I'd like to make a request as well as Administrator Gibbs, if we could have as soon as possible some of the data you're talking about, and then some sort of budget as soon as possible, right? I mean, I understand Commissioner Cosby's concerns, as well as Commissioner Miedema's. we all have questions and, I have questions too. So I think that, it's only fair that we didn't have anything in front of us while you were reading. I think that that's, lamentable, but it is what it is. I think that if you have something you can send us tomorrow, I think we'd appreciate that. The more time we have to prep, the better we'd be.
You will receive the budget as always, so you will.
So you won't, so you're not promising before Friday. You're giving us 3 days to examine the whole budget.
You have the budget and you'll have time to review it.
But which day will that be?
I can't make any guarantees on that.
Okay.
Commissioner Bonema.
Addie, thank you for being here today. You and I have had many conversations even before I was sworn in to become a commissioner. I always felt that your door was open. I always felt like you wanted to have conversations, even if they were uncomfortable conversations. I admire that. When we've sat down, you've listened, and then you've worked with me to problem solve. And then you followed up with me on different things to implement to address my concerns. So I respect that. I think that's where trust is built. I think my time spent in the health department buildings, walking with you at times, getting to know your staff, getting to understand the services, getting to really get a better understanding of the full and complete services that you provide was really beneficial. Have you spent time with other commissioners to my right to do the same thing for them?
I have not. The offer has been extended. I think every time I come and speak or present for the board or send information, extend it. I have not heard from any of the commissioners now.
So in 7 months or more of being a county commissioner, they've not come through the door to spend any time with you to get to know you or your services?
No.
I think that speaks for itself.
So Adeline, do you recall speaking with someone from Fox 17 on or around August 30th of 2023?
I'm assuming this is in the documents you sent. Or you provided?
Yeah, Matt Woodcoast wrote the article
Okay,
and given to you.
sure.
So did you state, I have not been involved in any of the conversations about public health programming and its potential cuts?
With Administrator Gibbs, correct? Yes.
Did you state, I have reached out numerous times to ask to be at the table or to say this is complex and we should meet and discuss with fiscal services? I have not received anything.
With Administrator Gibbs, correct?
Okay. So. And another question I have for you. Do you recall speaking with someone from Holland Sentinel? Sarah Leach wrote an article on or around August 30th as well on 2023.
Okay.
Is that a
This
yes?
is- This is in the document too.
Yeah, that's that
Mhm,
other
yep.
document. Did you tell the Sentinel that cuts to your budget could potentially close the health department altogether?
With the 2.5 million that I was given, yes, correct. I stand by that statement.
Did you state, quote, and to me, this is a threat to the foundations of the public health and the health and safety of our community?
Absolutely. No public health in the community is a threat to the health and safety of the community. I stand by that statement as well.
Did you tell the Sentinel that you offered to discuss public health programs, funding, and legal requirements on numerous occasions?
With Administrator Gibbs, yes,
And those offers went unaccepted?
correct?
Did you tell the Sentinel that the Fiscal Services Department is now creating the Health Department budget and bypassing you and your staff altogether?
Based on the email I got from Administrator Gibbs, yes.
Okay. And you've got that article in hand, so.
Mhm.
Right. Don't know if there's any other relevant health department information we need. Commissioners, any further discussion? I have emailed you. I am so sorry. I mean, I called too. I missed an email. It was when I was transitioning from my personal account to the county account. I missed one email. I looked at those 12 documents very closely. And I apologize for that, but I did also call. I left a goofy message, and I asked to meet with both of you. And I'm trying to remember specifically the timing, but I think it was before the 16th, actually. No. Do you have any questions of the board? Have any questions? All right, thank you very much. We are moving on to our second public comment.